the ones who ultimately paid the biggest price for this poor preparation were the people in the CHSLD.
More than 5,000 people died in Quebec's long-term care homes in the first year of the pandemic from March 2020 to 2021. 5 years after the crisis, a class action lawsuit is ongoing against the Quebec government on behalf of all residents of public long-term care homes that experienced major COVID-19 outbreaks during the pandemic's first year, spearheaded by Montreal medical malpractice lawyer Patrick Martin-Ménard. It alleges the province's response to the first 2 waves of COVID were improvised,
including the incomprehensible decision to ban family caregivers from having access to their loved ones in CHSLD, which combined with the already significant shortage of personnel in the CHSLDs at that time led to horrific situations, such as people either starving to death or dying because of lack of care. And if we had been prepared better, I think we could have avoided a lot of the pain and suffering.
In 2022, Quebec coroner Jeanne Kamel released a damning report into the long-term care deaths of seniors during the first wave of the pandemic, highlighting the lack of care. She made 23 recommendations to different government bodies, including implementing safer ratios of workers to residents and ensuring the necessary supply of protective equipment at all times.
Make sure that we have enough material, furniture, rolling. I would want to see relatives, caregivers, and users and residents committees be treated with more respect and be declared essential services so that thousands of elders will not die the next crisis.
I don't feel like we're a whole lot better than we were during COVID. Example, union negotiations for nurses and for staff. They've now insisted that they have more flexibility in choosing their schedules. And in doing so, it can sometimes not necessarily short staff, but in some cases short staff floors at the long-term care facilities.
Quebec's health ministry tells City News in a statement, work was carried out to improve the provision of care and services to seniors, and the second wave action plan included several measures, including the identification of a manager responsible for each CHSLD, the training of those responsible for implementing infection prevention and control measures. All angles of the COVID-19 pandemic have been analyzed since 2020, which has allowed us to learn lessons and important learnings from the pandemic management.
I'm hoping that we have developed the reflexes that will allow the public health authorities to react in a more proactive way next time.
In Montreal, Alyssia Rubertucci, City News.